it is almost certain that you or someone you love is at risk for diabetes. Worse, you could have diabetes and not even know it. The good news, you can control and even help prevent diabetes. If you'll invest the next 30 minutes in your health, it could be the most valuable half an hour you've ever spent watching TV. Welcome to Mastering Your Health, where we give you the most up-to-the-minute information you can use to take control of your health. I'm Dr. Shawn Benzinger. And I'm Pat Carlini. With recognized experts, we'll discuss and demonstrate fitness, make nutrition understandable and appetizing, go over the latest medical innovations and findings, and a lot more. We're all about helping you master your health. Today, our focus is diabetes. We're here today with Dr. Stanley Mirsky. He is a leading authority in diagnosis, treatment, and prevention of the disease. And Dr. Mirsky joins us now. We talk about the number of people with diabetes skyrocketing. Tell us, is everyone at risk these days for diabetes?
Almost everyone. It's not only the genes, it's the obesity, the type of diet, and how much exercise you do. It's not totally written in the stars that you're going to get diabetes. There are ways to counteract it.
Okay, now there's different types of diabetes, type 1 and type 2. What's the difference and which is most common?
Type 1 was called insulin-dependent diabetes. You do not manufacture your own insulin. You need insulin to survive. Type 2, on the other hand, your beta cells that's in the islets of the pancreas are producing insulin, but they're not responding. And it may be that the key is the fat cell around your middle. It is a factory. It produces 12 different hormones. One of them is called adiponectin, which prevents diabetes. The other one is called resistant. And when you put too much fat cells and too much fat in there, then you're going to get resistant and not adiponectin, and you will get diabetes. It's called insulin insensitive. 85% of diabetics are type 2. That's the obese group. Generally, they don't have to be obese.
Okay, now you've talked about diabetes actually being a stealth disease, and that's very interesting to use a term stealth. That's kind of frightening, maybe even concerning.
You think of the stealth bomber.
Okay.
Right? Type 1, you get the classical symptoms. Excessive thirst, excessive hunger, excessive urination. That's easy. Type 2 is often picked up on a routine exam. In other words, you go to your doctor, he does a sugar, he finds it's elevated. At that stage of the game, you may already have some changes in your eye that could possibly lead to blindness. You may have decreased circulation that could lead to amputations, and you have very often signs of heart disease, and there's fat deposited in your arteries.
So we've already progressed in this disease already and not even known it until your doctor screened it. That makes sense.
Okay, and how about we hear a lot about pre-diabetes? Is this along the same lines as that?
Pre-diabetes is very new, but very, very important. Pre-diabetes is when we found that we did glucose tolerance tests, or we checked the fasting blood sugar. When you were over 126, you were diabetic. You had crossed the border. But then they found that if you had a blood sugar of 100 to 126, there was 20% increase in heart attacks. And a lot of those people had the conditions that I mentioned before, the eyes, the heart, circulation. When you stop to think, if we have 23 million diabetics, we have twice as much pre-diabetics. And if to say half of those become diabetic, we've already doubled the 23 to 46. 50% will never become diabetic, but you don't know who. So the idea is to attack those 50% right from the beginning. The best attack would be diet. Again, low-fat diet. Hamburgers, hot dogs, fast food stores are the killer.
Okay.
There's a lot of people cringing out there right now.
Yeah,
it's unfortunate in our economy that it's the cheapest way to eat, but it's the most dangerous way to eat.
Absolutely.
And it kind of leads into our question from one of our viewers too. They ask, kind of all-encompassing, what are some of the best action steps to manage and prevent diabetes? Right, starting with the diet, right?
Starting with the diet, and then see what your waist size is. If you're 40 inches or more in a male, or 35 inches or more in a female, that means you really increase your chances.
I would consider, most people think this is a life sentence. Limited life, quality of life is very poor. It's not even worth living through. But that's not true, is it?
You can have a very good diet, and the whole family can enjoy that same diet. Fortunately, in this country, we have options. You can have sodas that are sweetened with Equal, Sweet and Low, Splenda. You can have cakes the same way. But you got to understand something. When you hear the term dietetic foods or diabetic foods, it's a fake. Because a diabetic pie is made with the fruit, which has natural sugar. You don't have to add sugar. And it's also made with a crust. So people say, oh, I had a diabetic pie, I'm home free. If they eat pasta and they put tomato sauce on it, they don't realize that's a killer. They could have olive oil and garlic, they could have pesto sauce, they could have clam sauce and still enjoy their lives. It's a give and take. You take away, you give. There's almost nothing you can't eat if you do it in moderation.
As for biggest risks, when you're looking at other organ systems, what's the biggest risk we have to be concerned about?
We have to be concerned about the heart primarily, stroke secondarily, or both. Very high.
All right, and now there are other issues. Kidney failure, nerve damage, non-healing infections, blindness, and amputation can all be complications of this, something that's very, very serious. Yet, diabetes is one disease that you can control if you decide to. Don't sit on the sideline and think you can't do anything about it, because it just isn't true. Dr. Mirsky, thank you for being with us.
Thank you very much.
All right, thank you. And stay with us. Coming up are action steps you can take today to control and even prevent diabetes and prediabetes. Welcome back to Mastering Your Health, the show that helps you take control of your health. We're with now Dr. Scott Reese, a board-certified practicing family physician and our medical expert. And we're also with Dr. Shawn Benzinger. Thanks for being with us. Now, how about overall, you probably deal with a lot of patients with diabetes.
Yes, absolutely. I see patients every single day with diabetes. And the problem is some of the complications we see from diabetes could be prevented by those patients themselves.
Okay, so overall you can control diabetes.
Absolutely can and need to, but it's a person's choice.
Okay, so why would somebody not choose to control their diabetes?
Well, that's the million-dollar question, Shawn. For most people, they know what to do, but it's a matter of when do you start doing it. They get lulled into thinking, diabetes, hey, it can't happen to me. But just the other day, right in my office, I had to tell a patient she had developed prediabetes. She burst into tears, saying, I can't believe this happened to me. I thought I was so healthy up to this point.
Okay, so let's say we decide to be proactive about diabetes. What do we do first?
A great place to start is to know your blood sugar and just check it and find out. Take this alcohol swab and clean off one of your fingers. We're going to use the side of one of your fingers, not the fingertip, because there's less nerves here, a little bit less sensitive on the side.
Okay, so it won't hurt quite as much.
That's right. It won't hurt Dr. Shawn at all.
Not at all.
All right.
Okay, how about the risks, Dr. Scott? If we're looking at the risks that people should be concerned about, what are the first things you tell them?
Well, I say ask yourself these three questions, honestly. Number one, am I overweight? Number two, is my cholesterol high? Number three, is there anyone in my family with diabetes? If the answer is yes to any of those, not only are you a risk for diabetes, you are at high risk.
Okay. Pat?
So I've got a little blood drop coming in. What do we do next?
Now what you're going to do is hold this monitor strip right up against that blood drop. In a few moments we'll have our number.
Okay, there we go.
Well, if we're dealing with symptoms and we're concerned whether we should be calling our doctor, should be concerned, what are those symptoms?
There are some symptoms of diabetes. Specifically, if you're experiencing excessive thirst, unusual hunger, excessively urinating, then you need to call your doctor immediately. You may have developed diabetes already.
Okay, I think I have my number here. So
yes.
I've got 78.
78?
Is that good?
That's perfect, Pat.
Good.
And you haven't eaten breakfast yet, right?
Right.
Good. So you want that number before breakfast to be under 100. You pass.
Okay, that's kind of a self-test.
Yes.
Are there other tests, other blood tests that you count on in your office?
Absolutely. I rely on the A1C test. The A1C is a test your doctor orders to give an average of what your blood sugar is doing over the last 3 months. Very important.
Now we've got two tests that do a good job of diagnosing or screening you for diabetes and prediabetes.
That's correct.
All right.
We can diagnose it. The problem is controlling diabetes. That's where we're failing. We are at war with diabetes. Right now, this minute, 57 million Americans have prediabetes. Most don't even know it. We are not winning the war.
So the light at the end of the tunnel, is it getting better or getting worse?
The latest studies show, and actually this is cutting edge information.
Okay,
You ready for this?
You gotta wait for this.
Best thing to do to prevent diabetes, lose weight and exercise.
Oh, that's it?
That's
Lose
it.
weight and exercise? There's no cure? There's no powerful drug that can cure diabetes?
Well, there is some really good news there. Actually, for those that are exercising, monitoring their diet, but it just isn't getting them. There are oral medications that seem to work, right, Dr. Scott?
Yes, that's right, absolutely. Okay. They work well. I've brought some here today as examples. These all work very well when taken as prescribed by your doctor. Some with the names of glipizide and gliburide. Now, these are generic medicines. Once or twice a day you take these. Another generic one called metformin. We use often in pre-diabetes, actually, to help sometimes try to prevent diabetes. Okay. There are newer ones that are just once a day. They have names like Actos, Avandia, very effective. Another one like this one, Januvia. The nice things about these last three are when taken by themselves, they won't drop your blood sugar too low. Very effective. Okay. And we actually have a new one too, Dr. Shawn and Pat. Now this is not insulin, but it is an injected medication called Byetta. The nice thing about this is when you take this, not only can it control your diabetes, it can help you lose weight, about 15 pounds on average.
All right, but it's not an insulin,
exciting.
so what if I do need insulin?
Well, there's good news there too. If you actually do need insulin, you don't have to hold up a needle trying to draw it from a vial anymore. Most of the new insulins come in pens, just like this one we have here. Simply dial up your dose and pull the top off with a fresh needle, and presto ammo, it's ready to go. Small enough to carry in your purse or even your pocket.
Okay, very convenient. Okay, so I'm going to need all of this for diabetes. You kind of have your hands full there, Dr.
I am, hands are full, absolutely.
Well, hopefully you don't need all of this, but I will tell you, it's a choice. You don't have to end up here.
Okay, all right, so I would choose not to end up right here.
Then your choice is to do this. Take control of your health and do things today. Remember, the very best way to prevent diabetes is to eat and exercise like you have it already. These are things you can do right now.
Dr. Scott, wonderful information, very educational and helpful. Now that you've chosen to fight diabetes and prediabetes, we'll show you the strategy that you must have in the most important battleground you'll ever face, the kitchen. Stay with us. Welcome back to Mastering Your Health, the show that shows you how to take control of your health. I'm Dr. Shawn Benzinger.
And I'm Pat Carlini.
We're here today with Jody Smith, who is our chef and nutritional expert. She works with diabetes patients regularly, and she's going to give us some simple guidelines to control our diet and some healthy cooking tips. Hi, Jody.
Hi, welcome everyone. What I'm about to say may surprise you. The most important key to controlling diabetes is what you eat. Diabetic patients must take control of their health by knowing what to eat and how to eat correctly.
Okay, tell us what that means, eating correctly.
Well, the first step of eating correctly is to know your carbs. A diabetic needs 40 to 45 grams of complex carbohydrates at each meal.
Now, complex carbohydrates are key because, frankly, they make a difference in how you absorb it into the blood sugar itself. It makes a big difference. Simple carbohydrates rush your sugar up, and that is something we have to be concerned about. Complex carbohydrates slow it down.
Okay, now this looks pretty good. Is this an example of complex carbohydrates?
Well, we've definitely got some complex carbs here, but let's start with breakfast.
Sounds great. What is for breakfast?
Well, let's start with a breakfast sundae. Does
Sundae?
that sound good?
I'm there.
Doesn't sound like a diabetic food, but it can be. So I'm going to have you guys make this, okay?
All right.
Well, I need you to start with the yogurt, and we're going to layer some yogurt with all the rest of these fruits. Little yogurt, little mango.
Oh, mango we have next, okay.
That's right. Little yogurt, some peaches.
Peaches look good.
Yogurt, some blueberries.
Blueberries, that's
blueberries on top.
I like
Yes.
the blueberries.
More the
Nice and high in
antioxidants.
antioxidants,
Talking
exactly.
About. Great. All right, I got the
Okay, how about some sugar-free granola?
Granola looks a lot better than the other cereals that are out there.
Yes, cereals can be a horrible carb landmine. Go easy. We don't need a lot, just a tablespoon or two on there. And we're going to top it off with some slivered almonds for a little protein and add a little crunch.
Okay.
Now, you guys just kind of threw that together, and sorry, but it doesn't look so hot. I made one with the correct amount so people can see how it really looks, and they can get the recipe off of our website. We add a cup of green tea to this, and you've got a great breakfast. Pat, try it.
You know, I think I will. I think this looks really good. I'm going to try it.
Right? Do you have another spoon?
I don't have another spoon, but I got a carrot.
You got a carrot. How about I trade you just one carrot?
Yummy.
The carrots are really good for you.
We'll look around for another spoon for you.
Thanks.
Okay?
I appreciate that.
Very
I'll remember it. The key for diabetics and those that might be in a pre-diabetic state is to honor a very good diet, one that is filled with healthy choices. However, to add to that, there are certain supplements that we think will help you enhance the quality of your health. Multiple vitamins and minerals, alpha-lipoic acid, calcium with vitamin D, vitamin C, chromium, and fish oils. Again, we want to remind you, you don't take these in lieu of having a great diet. The bottom line is this is to support the situation and are the recommendations of most experts across the country. When you're using supplementation, we find that if you use it wisely, it helps you master your health.
All right, well, it's all about being food smart, and I say it's a good time to move on to lunch. What do you think?
Absolutely.
Okay.
Jody, it looks great. What do you have?
I spent about 10 minutes last night, and I made a wonderful low-carb wrap with turkey.
Okay, now that sounds quick and easy, but you don't have to eat special diabetic foods?
Oh, no. We can eat regular foods. We just want to be food smart about how we eat them.
All right.
I also brought a whole plate of veggies and hummus.
Oh, this looks good. So you could load up on this, huh? That's a nice serving.
You really can. I've got some herbal tea to drink.
Oh, I love this. And I could just sweeten that a little bit. No, that's a no-no?
No. We've got to get the sugar out completely.
Okay.
13 calories per teaspoon, no nutritional value, simple carbohydrate.
Right. Get the sugar out of the diet.
All right, so we can't add sugar to that. How about sodas?
Oh, sodas are just flat out bad. Carb landmine, way too many grams of carbohydrate, loads of sugar. We don't want any of it.
Good to know. But am I going to get to eat some of this?
I promised Pat I'd share with her.
You know, I'm getting used to this.
Yeah.
It seems a little unfair.
Hey, we do have carrots, though, don't we?
Couple carrots?
2 carrots this time. Thank you. I'm feeling pretty good about this.
I'll let you know how it is.
Thank you.
Okay.
Hello.
Hi.
Welcome to our restaurant. My name is Mina. I'll be taking care of you. I'll let you take a look at that and I'll get you some water.
Thank you, Mina.
You're welcome.
In a restaurant setting, a key to mastering your health is controlling the menu. Any good restaurant will make exactly what you would like, so feel free not to use the menu. For instance, if I would like grilled chicken, broccoli, and some rice and a side salad, they will make it for me. So the key to mastering your health, in this case, is control the menu.
Yeah, a lot of people enjoy going out for dinner, and here's the big question now. Jody, what about fast food?
Honestly, Pat, it is really tough to stay within 40 to 45 grams of complex carbohydrate at a fast food place. You know, a personal pan pizza can pack a walloping 76 grams of carbohydrate.
Oh, okay, using a little too much at one sitting there.
Yeah, and it tastes so good.
It does, but you can have pizza. I brought one. Let's put this pizza out here and let me tell you what else you get to have for dinner.
Okay.
I can help you with that, Pat.
No, you just...
Now just wait a second. You can start with some hors d'oeuvres.
Okay.
Let's move this over here. So
those look good.
Yeah,
very nice.
Chips
in
and
the
salsa.
way the pizza, just so you know.
We can have a delicious salad with a little bit of vinaigrette.
Beautiful.
That looks beautiful.
Yeah, it
You
really
could start
does.
with the salad. Yeah.
Thanks for offering.
Kind of like
Now,
to jump right to
But the pizza really looks good.
The
All
reason
right.
you can
Can
have
help you
this
with this.
pizza versus any other kind of pizza is because I've made the crust with zucchini and yellow squash. You can get the recipe on the website. And you can actually have a whole fourth of this pizza and still stay within your 40 to 45 grams
That's
of complex
remarkable. It
carbohydrates.
is. And you know,
Looks
if I,
fabulous.
I don't need a plate
give
at
him
all.
a
I can
carrot.
just use a
Grab you the pizza, man.
Okay,
out of the
thank you.
pizza.
Tell you what, Jody and I are going to try this. This looks wonderful.
Well, just remember some basic guidelines. You need to stay within 40 to 45 grams of complex carbohydrates, and what you eat is the most important key to controlling diabetes.
That looks good, Pat.
It is wonderful. You've got to try this.
I should try that sometime.
After you're done with your carrots, you can have a little bite.
Thanks so much.
I'll
We're
tell you
gonna
what
have
we're going to
another.
do.
Thank you.
We get to eat a whole fourth at a sitting. So we come back after this. We're going to take this zucchini crust pizza, eat this, and we're going to do some exercise when we come back in just a moment.
Welcome back to
Mastering Your Health.
I'm Dr. Benzinger.
And I'm Pat Carlini. Whew, got a little exercise there, didn't we?
I did.
Working up a sweat. Well, we all need to exercise, and if you have prediabetes or diabetes, exercise helps keep your diabetes under control. We call exercise our invisible insulin. It's just that powerful.
When we say exercise is invisible insulin, we mean that exercise helps your body use sugar more efficiently and helps you balance your sugar up to 8 hours, and that is very powerful.
That's key. All right, well, good time to keep going since we got to...
You know, I volunteered to help the chef clean up.
Clean up duty. All right, well, let's head back now to where all the action is, and Heidi Tamburello joins me. Thanks for being with us.
You're welcome.
You're a physical therapist as well as a physical trainer, so you deal with this all the time. But when it comes to patients with diabetes, the key is really keeping your heart rate up, isn't that right?
That's right. Cardiovascular exercise is so important to get your heart rate up and get blood circulation going.
Okay, walking in place is a great way to start.
Walking in place is wonderful because it doesn't cost you a dime. It's fun. You can do it to music. You can do it watching a show. You can walk outdoors if you enjoy that more. You can add hand weights and add some resistance to your workout because as we age, we lose muscle mass. And just by picking up some weights, you can improve the quality of your muscles.
Get the muscle tone going.
Yes.
Okay, now to check the heart rate, how are we going to do that?
Well, if possible, get a heart rate monitor. It's a great device to have. If you don't have one, take 2 fingers, place it on your carotid artery, and you should feel your pulse.
You should have a pulse.
Yes, you should have a pulse, and you count the pulse for 1 minute, and they'll give you your heart rate.
Okay, all right, sounds good. How about how high do we want that heart rate to go?
Well, you want to find out what your target heart rate zone is, and an easy way to do that is there's a standard formula. You take 220 minus your age, and that'll be your max heart rate. You don't want to work at your max, especially if you're starting to work out. You want to maybe go at 50% and then work up toward 60, 70%, but there is a website. We have a website, and you can check that out there.
All right, so you can get the formula there.
Absolutely.
All right, what if we're looking for something a little easy on the knees?
Well, we could get on the bike here because you can do this in your home, and you can also go to enjoy the great outdoors. It is easier on your knees because you don't have the impact when you walk.
And let's look on down here. You want to also have a good pair of shoes when you want to get into some exercise, don't you?
That's right. You want to have a good supportive pair of shoes with good arch support. You also want to wear thick white socks so you don't get blisters. You want to have some water close by, and you also want to not exercise on a full stomach.
This looks a little more challenging. You can have some fun with this, right?
That's right. You could speed it up a little bit. You could go side to side. You could use your arms more. You can be very creative. As your fitness levels increases, you can just challenge yourself more, and you can do this great with a step. If you don't have a stepper at home, go up and down your staircase. You don't need any gadgets.
Pump the arms. That always helps the heart rate keep up.
Makes your heart work harder.
And about how much do we want to work out on a daily basis?
You want to work out 30 to 40 minutes ideally, but if you're just starting out, start out with 10 minutes a day, 3 to 5 times a week. That gets you started, and when you get used to it, then you just bump it up until you get to 30, 40 minutes. Ideally, do it every day.
And how do you know when you're working pretty good? You're working up a little bit of sweat. Maybe you're starting to talk with a little breath.
If you can still talk without gasping while you do your activity, you're probably pretty good in a good heart rate.
Okay, all right. You'll be able to carry on a conversation.
Yes,
at least
you do want to carry on a conversation.
Well, it looks good. We got a lot of great tips here today. Thank you, Heidi. Virtually, it comes down to whatever you can do to get that heart rate up.
That's right.
Is a great start.
Diabetes is a serious disease that's growing when it shouldn't be. Don't wait for the cure. It should not control your life's choices. Only you can choose to prevent diabetes. Call your family doctor today.
There are some things you can do. Count carbs, 40 to 45 complex carbs each meal. Get the sugar out of your diet and watch out for carb landmines. Get your heart rate up, do something, and then do a little more. We learned a lot about diabetes today, but we couldn't cover everything about diabetes in 30 minutes. Go to our website for more information that will help you control your health and a chance to win a free blood glucose meter.
For diabetes, there is no miracle cure. But miraculously, you hold the power to control or prevent it from happening to you. Let's get to work mastering your health.